Governor Mike Braun ceremonially signed 10 healthcare-related bills into law today, and he says that these laws will tackle rising healthcare costs and then add transparency and accountability to the healthcare industry in Indiana. Fox 59 State House reporter Hannah Adamson explains how.
During his State of the State, Governor Mike Braun pushed lawmakers to tackle rising healthcare costs and pharmacy benefit managers, also known as PBMs. Wednesday, he signed many bills into law that do just that.
We accomplished a lot in 1 year. Hallelujah.
As part of his Freedom and Opportunity agenda, Governor Mike Braun joined lawmakers in ceremonially signing bills Wednesday he says will tackle the skyrocketing costs of health care.
These landmark bills bring transparency, accountability, and competition to our healthcare system.
One bill Braun championed requires good faith estimates for healthcare services at least 2 days in advance upon a patient's request.
And protecting your right to know what you'll have to pay before you have to pay it. What a novel concept.
Another falls in line with his executive order, adding new Medicaid work requirements and more eligibility checks.
We need to encourage people to go to work. We want to help you. We want to be that bridge, but we also think you should be out there working if you're capable.
If the whole mission is to reduce fraud and reduce our costs in Medicaid, I don't think we should be going after the Medicaid patients.
But several other bills go after PBMs, the middlemen that manage prescription drug coverage. One of those bills requires PBMs to have a solid network of pharmacies that Hoosiers can easily access.
That is going to make it more fair out here for these pharmacies to be able to compete.
We need to make sure no matter where you live, you're within 30 miles of a pharmacy. We can't be shutting them down, which is happening all across Indiana.
Another protects more Hoosiers from high out-of-pocket costs. Specifically, PBMs and your insurance can no longer make you pay more for certain meds if you use a coupon or financial assistance to pay for them.
A lot of times your insurance company, the prices may be inflated because it's covered by insurance. So it's going to be people that are searching around trying to lower their costs. This just helps them out.
Another bill makes healthcare ownership more transparent, requiring PBMs, hospitals, and insurance companies to tell the state who owns them. It also gives the state's attorney general more tools to look into potential monopolies in the healthcare system.
There's a lot of money in healthcare, and so we want to know who owns the facilities and is that changing the prices.
Many of these new laws will go into effect either July 1st of this year or January 1st of next year. Another bill of note that Governor Braun signed on Wednesday, one that cuts red tape for organizations that try to help Hoosiers with cancer cover the costs of clinical trials. Reporting from the Indiana State House, I'm Hannah Adamson.
Still ahead, the latest on plans